Look at this plate. One side is completely eaten. The other side hasn't been touched. Not because the person wasn't hungry, not because they didn't like the food, but because their brain literally could not see that the other half existed.
This is left side neglect. It happens to thousands of stroke survivors every year, and most people have never heard of it. I live with it every single day, and today I'm going to show you what this condition actually looks like from the inside.
Left side neglect, or hemispatial neglect, is a neurological condition caused by damage to the right side of the brain, usually from a stroke. The right hemisphere processes spatial awareness on your left side. When that area gets damaged, your brain stops paying attention to anything on the left. I don't mean it has trouble paying attention. I mean it completely removes the left side of the world from your conscious experience. You don't see things on your left. You don't feel things on your left the way you should. It's not a vision problem. Your eyes still work. The information is coming in, but your brain throws it in the trash before it reaches your awareness. Doctors estimate up to 30% of right hemisphere stroke survivors develop some form of neglect. That's hundreds of thousands of people. Yet most people outside of neurology have never heard the term.
One of the first tests neurologists use to diagnose hemispatial neglect is the clock drawing test. They hand you a blank circle and ask you to draw a clock with all 12 numbers. A person without neglect draws the numbers evenly around the circle.
A person with left side neglect crams all 12 numbers onto the right half. The left side of the circle stays completely empty. And here's what's disturbing. The patient usually thinks they drew it correctly. They look at that lopsided clock with all the numbers jammed on one side, and their brain tells them it looks perfectly normal. That's the nature of this condition. It doesn't just take away your left side. It takes away your ability to realize your left side is missing. When I was first tested after my strokes, I failed the clock test. I remember looking at what I drew and thinking it was fine. When the doctor showed me what I'd actually put on paper, it was like someone pulled the floor out from under me. That was the moment I understood that my brain was lying to me, and it had probably been lying to me for longer than I realized. Left side neglect infiltrates every part of your daily routine. Shaving, I'll shave the right side of my face perfectly and completely miss the left. I'll think I'm done until someone points out half my face still has stubble. Getting dressed, my right arm goes through the sleeve no problem, but my left arm stays limp. I have to physically look at it and manually guide it into place. Eating, I'll finish everything on the right side of my plate and feel full, not realizing there's an entire half I never touched. Reading, my eyes skip to the middle of the page. The left margin doesn't exist. I'll read a sentence that makes no sense because I started halfway through it. Navigating my wheelchair, I clip door frames on my left side constantly. Not because the doorway is narrow, but because my brain forgot the left side was there. Every one of these sounds small on its own. Stack them across an entire day, every day, for years, and you understand the weight of this condition. People confuse left side neglect with vision loss all the time, and I understand why. From the outside, they look similar, but they are fundamentally different neurological problems. With vision loss, the visual information never reaches your brain. The pathway from your eye is damaged. You know you can't see on that side. You're aware of the deficit. With neglect, the visual information reaches your brain just fine. Your eyes are sending the data, but your brain's attention system throws it out. You are not aware that you are missing anything. That's the critical difference. A person with left visual field loss will turn their head to compensate because they know something is missing. A person with left side neglect won't turn their head because as far as their brain is concerned, there's nothing missing to look for. Now here's where it gets really complicated for me personally. I have both. I have left side neglect from the stroke damage, and I'm 45% blind in one eye from a Behçet's disease cataract. So I'm dealing with a brain that ignores my left side and an eye that can't fully see. It's a double deficit that compounds in ways that are genuinely dangerous. There's a related condition that often comes with left side neglect called anosognosia. It means you are unaware of your own disability, not in denial, not avoiding it. Your brain genuinely does not register that anything is wrong. In the early days after my strokes, I had moments of anosognosia that terrify me now looking back. I would insist that my left hand was fine, that I could use it, that nothing was wrong. Meanwhile, my left hand was sitting motionless in my lap, and I hadn't moved it in hours. When a therapist would ask me to raise my left arm, I would genuinely believe I was raising it. I could feel the effort. I could feel the intention. But my arm wasn't moving. My brain was generating a false sense of movement to fill in the gap. This is what makes hemispatial neglect so much harder to treat than people realize. How do you fix a problem that the patient's brain is actively hiding from them? The first step in any recovery is acknowledging the problem exists, and neglect literally prevents that first step. Rehabilitation has to start by breaking through the brain's own denial before any real progress can happen. There are therapies that help with left side neglect, but I want to be honest about what help actually means. It doesn't mean cured, it means managed. Prism adaptation therapy uses special glasses that shift your visual field, forcing your brain to recalibrate and pay more attention to the left side. Results vary from person to person. Visual scanning training teaches you to consciously sweep your eyes from right to left in a deliberate pattern. You're building a manual habit to replace the automatic awareness your brain lost. I do this constantly. Every time I enter a room, every time I move my wheelchair, I force a left side scan. Occupational therapy restructures how you approach daily tasks so your left side gets included. Mirror therapy, limb activation, and virtual reality programs are showing promise too. But here's the reality that recovery culture doesn't want to tell you. For many of us, neglect is a permanent condition we learn to manage, not eliminate. I've made progress. I'm more aware now than in the early days, but the neglect is still there every single day, and it probably always will be. Left side neglect is not just inconvenient, it is actively dangerous. Research shows stroke survivors with neglect have significantly higher rates of falls, longer hospital stays, and worse rehab outcomes. And the danger doesn't end when you leave the hospital. At home, neglect creates hazards everywhere. I've burned myself because I didn't register my left hand was near a hot surface. I've caught my left arm in my wheelchair wheel because I forgot to check its position. Stairs, curbs, and uneven surfaces on my left become invisible threats. In a wheelchair, one miscalculation on the left side can mean tipping or rolling into something dangerous. And because neglect dampens awareness, you often don't feel pain on that side as quickly. I've discovered bruises on my left arm hours later with no memory of how I got them. My brain didn't file the injury report. Living safely with neglect requires constant vigilance, and that vigilance itself is exhausting. If you're a stroke survivor dealing with left side neglect, I want to talk directly to you. I know the frustration of a hand that won't listen. I know the embarrassment of missing half your plate in front of people. I know the fear of not trusting your own brain. And I know the loneliness when nobody truly understands what this feels like from the inside. You're not crazy. You're not lazy. You're not failing at recovery. You are fighting a condition that literally hides itself from you. And the fact that you're still here means you are tougher than you give yourself credit for. And if you're a family member watching this to understand what someone you love is going through, thank you. The most helpful thing you can do is stop saying, "Just try harder," and start saying, "I believe you." The person with neglect isn't choosing to ignore their left side. Their brain is doing it without permission. Patience and showing up consistently matters more than any therapy exercise. This is rolling disaster. Left side neglect is one of the most misunderstood consequences of stroke, and I'm living proof of what it actually looks like day to day. If this video helped you understand this condition, hit subscribe because I'm going to keep showing the real side of disability that nobody else is talking about. Share this with someone who needs to hear it. Drop a comment and tell me, did you know left side neglect existed before this video? I'll see you in the next one.